Out in the wild, danger lurks, but few threats are as silent and swift as a venomous snakebite. Imagine this: you're trekking through dense undergrowth, sunlight dappling the forest floor. You feel a sharp prick like a thorn. Look down and there it is, 2 puncture wounds, already oozing blood. A venomous snake has struck. This scenario might sound like something from a horror movie, but for many adventurers and people living in snake-prone areas, it's a terrifying reality. Every year, thousands are bitten, some losing their lives to these often misunderstood creatures. But fear not, knowledge is your best defense. Knowing what to do and what not to do can be the difference between a harrowing tale of survival and a tragic end. In this wild world, being prepared is key. So let's equip you with the know-how to survive a snakebite. Panic. It's a natural human response to danger. But when it comes to snakebites, panic can be as dangerous as the venom itself. Why? Because when your heart races, your blood pumps faster, spreading the venom more quickly throughout your body. Take a deep breath. Focus. Remember this: most snakebites are treatable, especially with prompt action. Your clear head is your greatest asset in this situation. Instead of letting fear paralyze you, let it fuel you. Let it fuel your determination to stay calm, act quickly, and get to safety. Remember, you're tougher than you think. Not all snakes are venomous, and even venomous snakes don't always inject venom when they bite. This phenomenon is known as a dry bite, and it occurs in a significant number of snakebite cases. But how can you tell if venom has been injected? After a bite, it's crucial to watch for these symptoms as they can help determine the severity of the situation. Puncture marks. Look for 2 small, distinct puncture wounds where the fangs entered. These marks are often the first visible sign of a snakebite. Pain and swelling. Intense pain and rapid swelling around the bite area are common signs of venom. The pain can be excruciating and may spread beyond the immediate area of the bite. Discoloration. The skin around the bite might turn red, blue, or purple as venom affects the tissues. This discoloration can indicate the extent of tissue damage. Nausea and vomiting. Feeling sick to your stomach can indicate venom spreading. This symptom often accompanies other systemic effects of the venom: dizziness and weakness. Venom can cause a drop in blood pressure, leading to dizziness or fainting. This can be particularly dangerous if not addressed promptly. Breathing difficulties. In severe cases, venom can affect the respiratory system, making it difficult to breathe. This is a medical emergency and requires immediate attention. Remember, these symptoms can vary depending on the snake species, the amount of venom injected, and your body's reaction. Each snake's venom has a unique composition, which can cause different effects. When in doubt, always treat a snakebite as potentially venomous and seek immediate medical attention. Quick response can make a significant difference in the outcome. Every second counts after a snakebite. The clock is ticking, and your actions in the next few moments can make a significant difference in the outcome. Here's your action plan. Move to safety. Get yourself and others away from the snake immediately. The first step is to ensure that no one else gets bitten. No need for heroics here. Your safety is paramount. Avoid any sudden movements that might provoke the snake further. Stay calm. Easier said than done, right? But it's crucial. Keeping a level head can help you think clearly and act effectively. But remember, panic spreads venom faster. Elevated heart rates can cause the venom to circulate more quickly through your body. Take deep breaths and focus on the task at hand. Inhale slowly through your nose and exhale through your mouth. Immobilize the limb. Keep the bitten area as still as possible to slow venom spread. Movement can accelerate the venom's journey through your bloodstream. If possible, keep it lower than your heart. This helps to reduce the flow of venom to vital organs. Remove constrictions. Take off any jewelry or tight clothing near the bite. Swelling can happen quickly, and you don't want anything cutting off circulation. Swelling can happen quickly, and you don't want anything cutting off circulation. This can lead to further complications. Clean the wound. Gently wash the bite area with soap and water if available. This helps to remove any bacteria and reduce the risk of infection. Don't scrub, as this can push venom further into the tissues. Be gentle and thorough. Call for help. This is crucial. Dial your local emergency number or signal for help immediately. Time is of the essence. Dial your local emergency number or signal for help immediately. Make sure to provide clear and concise information about your location and the situation. Stay hydrated. Sip water to prevent dehydration, which can worsen the effects of venom. Dehydration can complicate your condition. Document, if possible. Take a photo of the snake from a safe distance or try to remember its markings. This can be incredibly helpful for medical professionals. This information can be vital for medical professionals. Identifying the snake can help them administer the correct antivenom. Remember, these are immediate actions. They are not a substitute for professional medical treatment but can buy you precious time. Your next step is getting professional medical help as quickly as possible. An ambulance or a trip to the hospital is essential for proper treatment. Section 5. What not to do. Separating myth from medicine. We've all heard the dramatic tales of snakebite remedies, cutting open the wound, sucking out venom, using tourniquets. Let's be clear, these methods are not only ineffective, but they can also be downright dangerous. Don't cut. Cutting the bite won't release venom and increases the risk of infection. Don't suck. Trying to suck out venom is ineffective and can introduce bacteria into the wound. Don't apply a tourniquet. Cutting off blood flow completely can damage the limb and worsen the effects of venom. Don't use ice or heat. Extreme temperatures can damage tissue and complicate treatment. Don't drink alcohol or caffeine. These substances can dehydrate you and interfere with antivenom. Stick to the basics. Immobilize, clean, and seek immediate medical attention. Leave the rest to the professionals. Section 6. The race against time, getting help. Time is of the essence with snake bites. The sooner you receive antivenom, the better your chances of a full recovery. Know your location. Being able to tell emergency responders your exact location is crucial for a speedy rescue. Signal for help. If you're in a remote area, use a whistle, mirror, or fire to signal for help. Stay put if possible. If you're alone, it's generally safer to stay put and wait for help, as long as you have a way to signal for assistance. Keep calm and conserve energy. The calmer and more relaxed you are, the slower your heart rate, and the slower the venom spreads. Remember, every minute counts. Stay focused on getting to safety and receiving professional medical care. Section 7. Knowledge is power. Preparing for the unexpected. The best way to survive a snakebite? Avoiding it in the first place. Prevention is always better than cure, and being aware of your surroundings is key. Here's how to stay safe in snake country. Know your snakes. Familiarize yourself with the types of venomous snakes that inhabit the area you are exploring. Learn about the venomous snakes in your area and their habitats. Watch your step. Snakes often blend into their surroundings, making them hard to spot. Pay attention to your surroundings, especially when walking in tall grass or rocky areas. Wear protective clothing. This can significantly reduce the risk of a bite. Long pants, thick socks, and sturdy boots can offer some protection. Use a walking stick. These simple precautions can make a big difference. Probe ahead of you on trails to rustle bushes and alert snakes to your presence. Don't disturb snakes. They are more likely to strike if they feel threatened. If you encounter a snake, give it a wide berth and let it go on its way. Most snakes will not chase you and prefer to avoid confrontation. Most snake bites happen when people try to handle or kill snakes. It's best to leave them alone and respect their space. Remember, snakes are an important part of the ecosystem. They help control pest populations and maintain the balance of nature. By respecting their space and being aware of your surroundings, you can enjoy the great outdoors while minimizing the risk of a dangerous encounter. Stay safe and stay informed. Section 8. Staying safe in snake country. When venturing into areas known for snakes, take extra precautions. Check your campsite. Before setting up camp, thoroughly inspect the area for snakes, especially under rocks, logs, and bushes. Secure food and trash. Snakes are attracted to food sources, so store food securely and dispose of trash properly. Sleep off the ground. If camping, use a tent with a solid floor or sleep on a cot to avoid sleeping at ground level. Carry a first aid kit. A well-stocked first aid kit should include essentials like bandages, antiseptic wipes, pain relievers, and a signaling device. Let someone know your plans. Always tell someone where you're going and when you expect to return, especially when venturing into remote areas. By taking these precautions, you can significantly reduce the risk of a snake encounter and enjoy your outdoor adventures with peace of mind. Section 9. Respect, not fear. Coexisting with reptiles. Snakes often evoke fear, but it's important to remember that they play a vital role in the ecosystem. They help control rodent populations and contribute to a balanced environment. Instead of fearing snakes, let's strive to understand and coexist with them. By educating ourselves about their behavior, respecting their space, and taking appropriate precautions, we can appreciate these fascinating creatures from a safe distance. Remember, knowledge is power. By being prepared, staying calm, and acting quickly, you can overcome even the most daunting challenges the wild throws your way. So get out there, explore, and embrace the adventure, safely and responsibly.